Welcome to Move to Learn, the Handspring webinar series for manual therapists and movement educators. Today's guest is Dr. Ann Baldwin, PhD, the author of Reiki in Clinical Practice, a science-based guide. Before the fascinating discussion and practice led by Ann Baldwin, let's go over how the webinar will proceed. First of all, we'll comprise about 45 minutes of discussion, including a short video presentation and guided practice. At approximately 15 minutes to the hour, we'll start in with questions. So please submit your questions in the Q&A area. The chat is on, so do say hello and tell us where you're joining from. And also you can greet your colleagues, your friends from around the world in the chat. Just recognize that we are recording the webinar and we'll share the link to it in our follow-up email. The webinar is also is streaming live on YouTube. So any comment that you put in the chat becomes part of the recording. We also bring your attention to the disclaimer that this discussion is for informational and illustrative purposes only and is not meant to impart medical or therapeutic advice or instruction. Please refer to Ann Baldwin's book, Reiki in Clinical Practice, a science-based guide for more information, where you will also find information on how to study and be trained in Reiki. Ann Baldwin is a researcher and professor of physiology at the University of Arizona. She has trained to Reiki master level and is a provider of Reiki to people experiencing stress-related problems, and has published over 120 articles in peer-reviewed scientific journals. She received 30 years of funding from federal institutions and has served on review panels for National Institutes of Health. With her Reiki training and scientific background, Ann bridges the gap between energy healing and qualitative scientific inquiry. In her spare time, Ann rides her horse and is a horse handler for Therapeutic Riding of Tucson. Ann Baldwin, welcome to Move to Learn.
Thank you very much.
Would you start us off by explaining how you were introduced to Reiki?
Yes, well, it's a very strange, convoluted story. Maybe I'll just start off by saying what Reiki is. So the word Reiki is Japanese for universal life force energy. And Reiki practitioners can channel the energy through their bodies. And then when they place their hands on a person and ask the Reiki to go to the highest good, then the body heals itself. And you can do Reiki not just on people, you can do it on animals, plants, anything basically. You can, even on your food, you can give Reiki to your food. So how did I become interested in something like Reiki when I'm a cardiovascular physiologist? Well, this was about 15 years ago. I was working on a research project testing blood substitutes that were being developed by companies to replace whole blood during transfusions. And I was working on rats and injecting these blood substitutes in the rats. And I was examining the intestine to see how it was responding to this kind of artificial blood. And I found that the rats that received the blood substitute, their intestines became inflamed, whereas the ones that didn't, the ones who just had control saline, they were perfectly all right. Then I moved my lab to a different place, to the University of Arizona. and my experiments didn't work anymore. All the rats showed inflamed intestine. It didn't matter whether they received saline or the blood substitute. And I tracked it down and discovered that it was the noise that was in the new facility that was actually stressing the animals so much, it was causing in the intestine.
Anne,
and
pardon me, Anne, excuse me,
yeah.
Anne, we just lost your volume for a couple of sentences. Would you go back to the noise and then what happened subsequently?
Yeah, so the noise was causing stress in the rats so that it was inflaming their intestines. Then I needed to hire a data analyst. So I hired a young woman to help me analyze data, and she turned out to be a Reiki practitioner. And as I said, I'd never heard of Reiki before. And she said to me, she explained what Reiki was, and she said, maybe we could do Reiki to the rats to get them less stressed. And we applied for a grant from the NIH, the National Institutes of Health, and we received a 2-year grant to do Reiki on rats. And so we had the animals in a room, well, one group of the animals in a room with noise, one group in a quiet room, and then another group in a room with noise, plus they received Reiki 15 minutes a day from practitioners just sitting by the cage, not touching the animals, but just placing their hands close to the cage and directing the Reiki to the rats. And then we had another group where we had a student who was not trained in Reiki, just pretending to send Reiki. And I will show you the results if I can share the screen, which I will do now. So here you can see the rats. This is a rat in the quiet room, and this is how many, so basically the blood vessels in the intestine were becoming damaged by the noise. This is a rat in the quiet room, rats in the quiet room, and this is the number of leaks in the blood vessels, and this is very small, and this is the area of the leaks, very small. This is a rat in the noise room, and you can see the leaks in the blood vessels are very much increased and the size of the leaks. And then this is a series of rats that received Reiki and noise, and you can see there's a significant drop in the number of leaks in the blood vessels and in the size of the leaks. And then this is the group of rats that received fake Reiki or sham Reiki, where the person was just pretending. And you can see there is a slight drop, but it's nothing as much as with the Reiki. And also, there's not much of a change in the size of the leaks. So this really convinced me that Reiki was doing something. I was very skeptical at first, but when we did the experiments with the rats, and we saw that the rats that received the Reiki showed less inflammation because of the noise, that really made me convinced that Reiki was working. And we did get this work published in Journal of Alternative and Complementary Medicine. So that is how I became interested in Reiki, through the rats.
And I understand that you are you continue to work with Reiki and animals, but how about speaking about your research and practice regarding Reiki with humans?
Yes, so the Reiki actually completely changed my life. So I went from not really believing it to having it take over my whole life, in that I gave up my tenure at the University of Arizona. I gave up my full-time tenure because I wanted to go out into the community and practice myself. So I became a Reiki master myself, and I wanted to practice Reiki on people as well as animals. So I retained my affiliation with the university, but part-time. And then I started my own business, Mind Body Science. But I did do some research through the university with regards to what Reiki does to physiology. And one thing that happens when people do Reiki or receive Reiki, they feel their hands getting very warm. that happens a lot. And so my question was, does doing Reiki actually increase the blood flow in the hands? And so I would just go back to sharing the screen again, because I will show you some interesting results. Oops. Here we are. So this is a neat device I have called a laser Doppler perfusion imager that scans the hand and images the blood flow in the fingertips. So you can see here the top panel on the left. Those are fingers of a Reiki master just before they start doing Reiki. And if you look in panel B below, you can see the difference when they start doing Reiki. And although this is not in color, you can see that these the fingertips become very bright, meaning that the blood flow is really increasing significantly in the fingertips when they give Reiki to themselves. So we have some data here. So we had 3 groups. We had Reiki masters who had their hands scanned before they gave Reiki and then during Reiki. And then we had another group who did another form of energy healing called reconnective healing. And then we had the control group who just looked at a calming picture, just sat there and looked at a picture. And you can see, if you look at the dark circles, you look at the first 4 dots, that's before they started doing Reiki. Sorry, the first 3 dots before they started doing Reiki. And then the next 4, you can see an increase in the percent of perfusion. That means the blood flow. So you can see an increase in the blood flow, a steep gradient going up as they're doing Reiki. That's the next 4 points. And if you look at the other 2 groups, you don't see that with the controls or with the reconnective healing. So this is statistical analysis showing a significant increase in blood flow in the fingertips of people doing Reiki when they start doing Reiki to themselves. And this was over a period of a few minutes. So I think about 5 minutes before they started doing the Reiki and then 5 minutes afterwards. And then you can see the dots kind of plateau. So the blood flow, even when they stop doing Reiki, the increased blood flow is still visible in the fingertips. So that was also published in a peer-reviewed journal. So that was very also another very convincing experiment for me, showing that yes, definitely, not only do your hands get warm when you do Reiki, but there's significant evidence that the blood flow increases in your hands. And it's important that the Reiki can affect blood flow, because in the peripheral regions like the feet and the hands, especially if you live in cold climates, people often suffer from lack of blood flow in those regions. And so if you can just do some Reiki, you can warm up your toes and your fingers very easily. So that's a very good use for Reiki. Another study that I did that I'll just briefly talk about was range of motion. People often have trouble with their shoulders, restriction of movement. For example, maybe they have arthritis, maybe they have frozen shoulder, maybe they've had a shoulder injury. And so I was involved in an experiment where we recruited people with restricted range of motion, meaning that they cannot raise their arms over their head like that. They're not able to do this motion. Maybe they can just get up to here. So we recruited those people, and all they received was one 15-minute session of Reiki. So we measured them before and after the Reiki session. We had another group who received reconnective healing, another group who received physical therapy, another group who did not receive any treatment, and then another group that received sham Reiki, where someone was just pretending to give them Reiki. And we did find that both reconnective healing and Reiki and physical therapy, you'll be pleased to know, they all did increase the range of motion of these people. And I think we had about 30 or 35 people in each group. So I'll just share the screen to just show you those results. So here's an example. This is an example of someone showing restricted range of motion. And you can see the lines there. So we can measure the angle between how far they can raise their arm and the horizontal. And here are results: range of motion on the vertical axis and groups on the horizontal. So group one was the control group with no treatment. And the dark circles are before treatment and the open circles after treatment. So no change here in range of motion. Number two is the fake Reiki or sham Reiki, no difference at all. Number three is physical therapy. So with physical therapy, yes, there was an increased range of motion. It did loosen them up. And then Reiki, interestingly, the one that for some reason, the Reiki group, they started off with much lower range of motion. So they were really the most impaired. And you can see there was a very significant increase in their range of motion after one Reiki treatment. And also the same with reconnective healing. We saw an increase in range of motion. We were interested in pain as well, self-perceived pain, and we asked them to evaluate their pain from 1 to 5, where or 0 is no pain at all, and 5 is, no, I think we had 10 here, yeah, 10 was the worst pain possible. And once again, we're looking at the dark circles are pain before treatment and the open circles after treatment. So the controls, there was no different in the pain level. And interestingly, this is the sham Reiki, and the pain level dropped with the sham Reiki. So that's kind of placebo effect. So it's interesting that sham Reiki, it can't improve their range of motion, but it did reduce their pain a bit because someone was actually pretending to give them a treatment and pretending to give them attention and take care of them. So that's basically the placebo effect, which we saw here. The third group here is the physical therapy, so also a reduction in pain. The fourth group is the Reiki, significant reduction in pain. And the fifth group is reconnective healing, also a significant reduction in pain. So if we're focusing on the Reiki treatment here, yes, the Reiki treatment definitely reduced their pain and increased their range of motion. So those are two experiments that are studies that I'm going to talk about today. But if you get my book, you will see many, many experiments, not just by me, but by many other investigators on many different aspects of use of Reiki. So basically, I have a chapter on many diseases and disorders. For example, how does Reiki help with pain during and after surgery? How does Reiki help with anxiety? How does Reiki help with circulation? How does Reiki help with knee problems and joint problems? So all of those are in the book with evidence showing how Reiki can help in each case. So
Anne, is it possible now to for you to lead us or facilitate some experience? There are many people on the call who are Reiki trained, but many others, including me, who have not been trained, and I must say my toes are a little cold.
Okay, so it's that air conditioning, right?
Well, it's the natural air conditioning that is prevalent just north of the Golden Gate Bridge. It's called fog.
Okay. Yes, I'd love to do that. So Dr. Usui, Mikao Usui, who was one of the founders of Reiki and founded Usui Reiki, and this was the end of the 1800s, beginning of the 1900s, he did an exercise with his students called Gassho meditation. The word Gassho means hands in prayer position. And he did this with his Reiki students before they would start Reiki, because it really helps the Reiki energy flow. And so I will do that with you. I'm going to share my screen. Before we do this, though, I would just like to tell you what it does to your heart, because I read about this kind of meditation, and at that time I was working on something called heart rate variability, how the heart rate changes with time, which is a biomarker of stress, of emotional stress. And what I discovered was that Dr. Usui's Gassho breathing actually puts the heart rate variability, alters it, so it reflects that the body is in this very balanced state, very balanced between sympathetic and parasympathetic. It's a state of relaxed alertness, sometimes known as coherence. And I'd just like to show you some evidence for that before we do this meditation, just so you know what is happening to your body as you do this meditation. And it works whether or not you've been attuned to Reiki. If you have been attuned to Reiki, the effect is much greater. So I'm going to share the screen right now. So just a little bit of instruction before we go on to the meditation. So this is just to show the heart rate variability. If you look at the bottom panel, the vertical axis is heart rate and horizontal axis is time. So we have about 3 minutes. That's showing about 3 minutes. And you can see in the bottom panel, this is someone who is not doing the Gassho meditation. And you can see the heart rate is kind of randomly going up and down. There's no real pattern to it. But if you look at the top one, you can see that the Gassho meditation has an incredible effect on how the heart rhythm is changing. So basically, if you do the Gassho meditation, as you breathe in, the heart rate goes up. As you breathe out, the heart rate goes down, and it forms this beautiful wave. And that is a sign of this beautiful balanced state of relaxed alertness. And and I'm really amazed that Dr. Usui knew that this kind of breathing, which I'll show you in a minute, was making people get into this beautiful, relaxed, alert state so that the Reiki energy could flow better through them, could flow more easily through their bodies. Not only does that signal stay in your heart, it also goes through the nervous system to your brain. So if your heart is sending this lovely wave, this coherent wave through the nervous system to the brain, it goes to a part of the brain called the thalamus that is responsible for organizing activities in different areas of the thinking part of the brain so that you can think more clearly and solve problems more easily. Which is great, which Reiki does help you do. And then not only does it stay in your heart and your brain, your heart and your brain creates what's known as a biofield, an electromagnetic field that's around your body. And your heart field can stretch as far as 15 feet. And when you get into that relaxed, alert, coherent state, with that rhythm going in your heart, it not only stays in your heart, it vibrates in your whole field outside your body. So when you do this meditation, that is what's happening. Your heart field is vibrating at this particular frequency, which is, it's 0.1 hertz, 0.1 cycles per second, or six beats per minute. And so let's get on with it and let's do it. So I'm going to give you a flower to look at and I'll explain the meditation. So you can put your hands in prayer position if you want to, but you don't have to. And if you've been attuned to Reiki, I want you to breathe a nice deep breath in. And as you breathe in, attune to the Reiki, breathe the Reiki in through your crown and make it feel it filling your whole body. And then as you breathe out, imagine it radiating out of every pore of your body. If you're not attuned to Reiki, imagine a beam of light. Breathe in a beam of light through your crown into your body till it fills your whole body. And then breathe it out, breathe the light out so it radiates out of your body. And I have a musical rhythm that I'm going to put on, and you can breathe in time with that rhythm, nice and slowly. And we'll do this for 1 minute. So I'll put the rhythm on now. So breathe out. breathe the Reiki in. Breathe out. Okay, so you can tell me at the end how you felt, if you felt more relaxed, if you felt energized. And as I said, this puts you into that state of relaxed alertness, which means that basically you're ready for anything. You're relaxed, but you're not, it's not like you've just drank a glass of wine, not that kind of relaxed. You're relaxed, but you're capable of doing anything, just like maybe, or you're on the tennis court, you're ready to get that serve. You're right close to the net in the center, because if you're right close to the net in the center, doesn't matter where the ball goes, you're ready. And that's the kind of state that this meditation puts you in. And as I said, it doesn't just stay within you, it goes out in your field, in your electromagnetic field that your heart produces, and it vibrates. And interestingly, we found, I do research with horses as well, and we found that horses are really sensitive to Reiki and to what people are projecting in their field. They're extremely sensitive to Reiki. I've given horses Reiki many times, but they're also very sensitive to the vibration that Reiki creates in people's electromagnetic field. So I'm going to show you a video of a student who is sitting in a round pen doing Reiki. She's getting into this coherent Reiki state, and she has a little device that tells her when she has reached this coherent Reiki state. And I want you to watch how the horse responds to her. So it's a very short video, and I'll share my screen and show that to you. So here's the horse. The student, you can't see her, but she's somewhere over here. And I'll just start the video. So there's the horse, and the horse is kind of, there's the student, you just caught a glimpse of her. The horse is not very interested right now, but I want you to watch in just a few seconds what that horse does. Okay, he's picked up something. Now look at his ears. His ears are like antennae. He's picked up a signal. And you can see he's gone straight over to that student. And I've seen this countless times. Okay, so I will unshare my screen. So yeah, so you can see the horse was so sensitive. The horse knew exactly when she was doing Reiki and she got into that beautiful, relaxed, alert state. So Reiki actually makes you more attractive, and we think it also attracts people as well. And there is some scientific evidence showing that people are attracted to this vibration in the heart, because basically it signals to them that you are you're stable, you're calm, and you're not going to do anything crazy. So that's why the horse is attracted to that kind of person. So I was really impressed by that meditation that Dr. Usui did with his students, and it really helped them do the Reiki.
Yes. Anne, is now a good time for you to speak about the applications of Reiki in hospitals, or does that come at a later time?
I think now would be good. Yes.
Okay, good.
So maybe I would just, before I talk about Reiki in hospitals, I just go quickly over the scientific evidence, not just the experiments I've done, but that other people have done. There are currently close to 90 peer-reviewed original research studies on Reiki. And they basically show that Reiki is good at relieving anxiety and depression, at reducing chronic and acute pain, and also at enhancing general well-being and preventing burnout. So almost every disease or disorder or reason that you're in hospital involves anxiety and pain at least. And so you can see how Reiki really plays a very important role in hospitals. And we do hope that we can make it more widely accepted by the medical field and more widely available for people in hospitals. So I'm going to show you some evidence. There are programs that have been carried out both in the United States and in the UK in hospitals to show how Reiki can benefit patients. So I'll just share my screen for a little bit. Oh, this was just, I'm involved in the Center for Reiki Research, and we meet monthly, and we have developed a system where we can objectively review new Reiki research papers. We have a team to do that. So we look for the articles, we evaluate, at least 2 members of the team evaluate the articles in an objective way, and then we summarize them and put them on a website, which is www.centerforreikiresearch.org. And you'll see that at the end. That is, you'll see that on a slide at the end. So we have that way of evaluating the papers. And this is just to show that as time goes on, so this is the number of articles. These are the better ones that we've reviewed. As time goes on from 1996 here up to 2019, you can see that basically the number of Reiki research articles has increased. The quality is also getting good. This was a bumper year. 2016 was a bumper year. The green and blue means that these were particularly robust papers. We have another one in 2019, which was very excellent. And then 2020, we already have 3 more papers. So the number of research papers is increasing. But basically, the research has shown, 14 articles have shown that Reiki reduces pain. 6 articles, these are the good ones, have shown that Reiki assists with pain and reduces anxiety in patients before and after surgery. 5 articles show that Reiki reduced symptoms associated with chemotherapy, like fatigue and pain and anxiety. 6 articles show Reiki reduces emotional stress. 8 articles improved relaxation and well-being of patients. And 4 articles reducing anxiety and depression. So benefits of Reiki for patients and caregivers can be summarized as follows. And this is why Reiki is going to be very useful when it gets more widely used in hospitals and clinics, reducing stress and anxiety, and giving people some control. If they can receive Reiki, and especially if they can do Reiki for themselves, they have some control over the pain they're feeling, the anxiety they're feeling. And that goes a long way to helping the healing process. Also promoting trust between patient and caregiver. And also Reiki appears to, by making the people relax more, it helps the drugs work better. And there is some evidence that people more quickly after particularly surgery. And for caregivers, reduces stress and burnout and promotes positive well-being. Yeah. Mm-hmm.
And pardon me, just because there was a warble in the audio, would you discuss number 4 again?
Yes. So number 4, for the patients, if they're already taking conventional pharmaceuticals and drugs, Reiki will get those drugs to work more effectively, because Reiki gets the person to relax. And if you're not producing lots of stress hormones, which may adversely affect the effectiveness of the drug will work better. So that's what number 4 was. And then number 5 was shorter recovery times. So I have a couple of slides here. This is a study done at Hartfield Hospital in Connecticut. And this was done on the one on the left was done on 600 patients. And it showed they received Reiki. So the on the left, the histogram column on the left, this one is before Reiki, and this is how much pain they're feeling. The higher the number, the more pain. And this is after Reiki. Sorry, this is relaxation. So they felt more relaxed after Reiki, and this is the pain, and less pain. So this was based on 600 patients. And then the one on the right, this was Caregivers, and this was done on 44 employees in the hospital. And this, once again, is increased relaxation. So they felt more relaxed or less stressed, less pain, and also less fatigue. So 3 good reasons for having Reiki in hospitals: relaxation, less pain, and less fatigue. And at this moment, I would like to talk briefly, if I have time, about a program that is being carried out in the UK called Connecting Reiki with Medicine at St. George's Hospital, London. St. George's Hospital is one of the greatest, or one of the largest teaching hospitals in Europe. And they have a wonderful Reiki program in which Reiki practitioners are trained for 6 months to learn about medicine, to learn about medical verbiage, so they can communicate with the healthcare providers, with the doctors and nurses, and understand all the terms, the medical terms. So they're trained for 6 months to understand what's going on in the hospital, what's going on with the patients. And then they give Reiki to patients in the ICU and other parts of the hospital. So this is a wonderful program that is going on right now. And they're trying to develop that further and to get data, how the patients are benefiting. They also have developed another program. They're in the process of developing that, which is Reiki Medic Care, in which they're trying to couple frontline healthcare providers with Reiki practitioners, so that the healthcare providers can receive Reiki remotely. You can send distance Reiki. They receive Reiki remotely, and then they will, in return, fill out a questionnaire with regard to their symptoms. Maybe they feel tired, maybe they feel stressed, so that we can see how that helps the people on the front lines now in this very stressful time. They are looking for donations to get these programs sustain these programs. And I think in the chat box, there's a link. So if you feel inclined, you can send a donation to help the research to increase the effectiveness of Reiki in hospitals.
Yeah.
So, yeah.
And I have a question. That's most people who have experienced Reiki say that it's very relaxing. How do you explain the physiological mechanisms? Have there been physiological mechanisms that identify to explain this relaxing effect?
Yes, in fact, I mentioned the term heart rate variability, how the heart rate changes with time, and the pattern that it changes with time. It depends on how much relaxation or parasympathetic nerves are activated compared to sympathetic. So the sympathetic nerves kind of rev you up, get the heart beating faster. The parasympathetic slow it down, put you in the rest and digest state. And it's been shown through readings of heart rate variability and through taking samples of saliva for stress hormones, that Reiki affects the parasympathetic nerves. And the main nerve is called the vagus nerve. It's the largest nerve in the body, or the longest nerve in the body. It goes all the way from the just below the skull, all the way down to the coccyx, the bottom of the spine, and it innervates every single organ, and it helps relax. And it has been shown that Reiki, when you receive Reiki, your vagus nerve is stimulated to put you into that relaxed state. Another thing that the vagus nerve does is it releases a neurotransmitter called acetylcholine, which is an anti-inflammatory agent. So there you have like 2 for 1. Not only is Reiki making you more relaxed through the vagus nerve, it's also reducing any inflammation that you may have. And for those of you who are aware, the COVID virus, the way people react to the COVID virus is greatly exacerbated. It's much more severe if they have an undergoing inflammatory process going on at the same time. So anything we can do to reduce inflammation is going to help with that too.
Yes. There's a question from a world respected manual therapist and movement therapist as well. And this person asks, please share suggestions as to how Reiki and other energy workers can protect ourselves from toxic energy emanating from a client.
That is a really good question and very practical. Yes, definitely. So I'll tell you what I do, and I have spoken to many other Reiki practitioners, and they do very similar process. So basically, whenever I do Reiki, I'm also doing that gassho breathing at the same time, because I know it facilitates the flow of Reiki. But as I showed you, that gassho breathing is also causing that beautiful vibration in your heart field. And it's been shown that if you can protect yourself by doing Reiki and doing the gassho breathing nice and slowly. So you get that vibration going in your biofield, your heart field. So you have like a balloon of electromagnetic energy around you that is vibrating at this particular frequency that has been shown to be protective, both emotionally and physically. So it's a really easy way to protect yourself if you feel that there's anything going on in the environment that you need to be protected from. So very easy to do. If you are Reiki 2 or Reiki Master, then you have the symbols too, and you can use the symbols as well to protect yourself.
Thank you, Anne. The questions in the Q&A are accumulating, and there are quite a number of questions in the chat as well, so we have time to get to both. Tatya says, hello, what's your view on distance Reiki attunements? I completed one recently that was very successful. However, not all agree on its efficacy.
Yes, I'm thinking about that myself as well, and I've come across the same controversy. So yes, you can learn how to do Reiki attunements virtually. That's true, and I think if you have some kind of connection through Zoom where you can see the person, I think that's very helpful. And personally, because I know that Reiki works through a distance, it makes sense that you can do a virtual attunement. I think that it is valid. That's my personal opinion. Although the feeling that you get, I mean, every time I do an attunement and I'm standing close to the person, I have my hands on their shoulders, and I just feel this beautiful feeling of closeness and energy flowing through me and flowing through them. I have not, so just to let you know, I have not given virtual attunements myself at this point. So I don't know how it would feel to me, but I was wondering if maybe I would miss that closeness and that that beautiful warm feeling that you get when you do a hands-on attunement? I don't know. But as far as validity is concerned, because Reiki works through a distance, I think that they probably are valid.
Another question, this one from Michael Hall. I understand that when the body is in a state of stress, the body won't assimilate nutrients. Will the parasympathetic effect of Reiki help with assimilation of nutrients?
That is a really good question. No one has asked me that before. And yes, I think because another name for the parasympathetic component of the autonomic nervous system is the rest and digest part of it. So absolutely, if you are relaxed, that puts you into the best way to digest your food and to receive nutrients. So it's getting into that rest and digest will help activate the intestine so that it's more able to absorb nutrients from the food.
Right. I think it's time to recruit some, to ask if some rats would be available to participate in this, given your earlier history of success with rats and research.
And food, yes.
Yes, of course. That's right. Well, given, their intestines and the reduction of inflammation, et cetera. Right. Mm-hmm. Right. Yes. We have a question. Are the Gashao breath and Reiki techniques discussed in your book?
Yes, absolutely. I think they're very important. And as I said, whenever I do Reiki and whenever I teach Reiki, I'm very, very strict about the breathing, because I think it makes a huge difference to how effective you are as a Reiki practitioner. And also when you're receiving Reiki as well, it opens you up. When you do that deep, slow breathing, even if you have not had a Reiki attunement yourself, but you're receiving Reiki, it allows the Reiki to come in and work more effectively. It's basically, so maybe many of the people who are participating in the webinar, they know about the chakra system. So the chakra system originated from the teachings of the traditional Indian religions. And these are energy centers in the body where energy can enter and leave the body. And there's a channel that goes from the crown all the way to the root chakra. Energy can flow all the way through. And I like to think of that as sometimes that gets blocked and sometimes it's nice and clear and open. And it's just like the pipe, when the pipes get clogged up, when you have too much calcium in your water and the pipes get clogged up. That's kind of similar to blockage of your chakra channel. And when you receive the attunement, that is cleared. But also, even if you're doing just the breathing, the Gashao meditation breathing, that helps open up that chakra, that channel, so that you can receive the Reiki more effectively and it can work better. So definitely that breathing is extremely important.
And I believe that you have an opening slide, not exactly of the chakras, but of the nerve plexus.
Yes.
Would you like to share that just to amplify your point?
Yeah, so here it is. So this diagram was published in 1927. So it's very old, but it's very relevant. And you can see, unfortunately, my cursor, my pointer is not working right now, but you can look at those little like flower projections. There's one at the crown, and then there's one at the third eye, one at the throat. Those are the main chakras where the energy comes in and out. So chakra is actually Sanskrit for wheel. And what I want you to notice is at the position of each chakra, there is like either an organ or a gland or a neural network. So those little lines are neural networks, and they feed the organ or the gland at that particular location. So what this means is that Reiki energy can come in through the chakras, and maybe the body, what can the body do with this weird energy? We don't even know what this energy is, but because it's located right at these neural plexuses and organs and glands, the energy can stimulate those nerves to release neurotransmitters. The energy can stimulate the glands to release hormones. And in that way, the body can use the Reiki energy in a way that the body understands, in a physiological way. So Reiki helps the body heal itself. So what it's doing is that it's making the body produce the right amount and the right type of neurotransmitters and hormones for its own good. So that is how Reiki helps the body heal itself. It helps the body use its own ways of healing, but in an optimum way.
Thank you. Here's a question from Isabel. Hi, I would like to know if there is evidence about the effect of Reiki on high blood pressure.
Okay, so yes, there is. Unfortunately, there are not that many studies, but there are a couple. And both of those studies showed that Reiki does significantly reduce high blood pressure. So as you know, when you have your blood pressure taken, you get two numbers. There's systolic, the high number, and diastolic, the low number. So systolic is after the heart has beaten and pumped the blood into the aorta. And then diastolic is when the heart is resting between beats. So those are the two numbers. And systolic pressure has been shown, if it's high, has been shown to be reduced by Reiki. But interestingly, as I'm sure you know, Reiki goes to the highest good and it goes where it's needed. Reiki has its own intelligence. So if you already have perfectly good blood pressure, a normal level, or even if you have low blood pressure, Reiki is not going to make your blood pressure go down, because Reiki works for the highest good. So if you've got normal blood pressure, we don't want it to come down anymore. So it does work. If you have high blood pressure, yes, it does help bring it down. And I think that's part of the reason for that is that Reiki stimulates the vagus nerve that helps with the rest and digest.
Thank you.
In fact, going back to Reiki working for the highest good and going where it's needed, I did another study on rats. So I only told you about one study. I did another study on rats. And these rats had little transducers inside them that would give me information about their heart rate and their blood pressure. And we were subjecting these rats to just 15 minutes of noise a day. And then we were looking to see what happened to the heart rate and the blood pressure. And some of the rats got Reiki. And so we thought, okay, well, the noise kind of makes the heart rate go up. And so let's see if if they have Reiki, if it stops the heart rate from going up. And what we found was that in cases where the heart rate did go up, it didn't go up in all the cases. In cases where the heart rate in the rats went up, the Reiki brought it down. In cases where the heart rate didn't go up, the heart rate stayed the same. The Reiki didn't do anything. So I thought this was a really nice illustration of Reiki going to where it's needed and not bringing down a physiological parameter that doesn't need to be brought down.
From Paula O'Connor comes this question. Hello, do you foresee Reiki being more widely available and used in UK hospitals anytime in the near future, based on the findings from the St. George Hospital study in London? Many thanks.
I absolutely hope so, and that is our goal. So I am working with Fiona Gray and Rosalie Farrow, who are in charge of those programs at St. George's Hospital, and we are working to expand them and to get more data, because we feel that if we can get more data on how patients are benefiting from Reiki, that will help medical professionals who maybe don't know anything about Reiki. That will help them become more convinced that Reiki should be more widely available. So in answer to the question, yes, I do think that Reiki will become more available as a result of those programs. Absolutely.
A second question from Michael Hall. In Chinese medicine, there is a law that qi energy governs blood. Is it the same with Reiki?
Yeah, I think that's true. That's a really good question as well, because blood flow it's governed by obviously the heart, how much the heart is beating, the heart rate, and the contractility of the heart, and also the small blood vessels called arterioles. So here's a physiologist coming out in me. So there are these small blood vessels, little arteries called arterioles that have muscular walls, and they're in charge of regulating blood flow. And so it's the nervous system, the autonomic nervous system, that controls how constricted these blood vessels are and how dilated they are. So if they're dilated, more blood will go through, and if they're constricted, less blood will go through. So seeing as Reiki has a relaxing effect, that would be consistent with dilating the blood vessels, so more blood goes through those tiny little vessels to the organs. So yes, the Reiki or the Qi goes where the blood goes, or maybe the other way around, the blood goes where the Reiki goes. Absolutely.
From Chris Frederick, who's the co-author with Anne Frederick of Fascial Stretch Therapy, his question: any studies on Reiki and post-traumatic stress disorder and/or studies on Reiki for mental health?
Yes, there are quite a few studies. I can't remember exactly how many, but there are quite a few studies on Reiki with PTSD patients or people who are suffering from PTSD. And although most of them are based on questionnaires, established questionnaires, they all show significant effects of Reiki. Reiki really does help with people who are suffering from PTSD. And I would like to see more research with more physiological measures, maybe taking like samples of saliva and measuring, or blood, perhaps, maybe saliva, not blood, measuring saliva for various hormones and antibodies, etc., to see how more objectively how Reiki helps in those conditions. But right now, yes, the objective questionnaires, they are established questionnaires. They've been tested and retested and calibrated, so they are valid. And in fact, a whole chunk of my book, there's a whole chapter on those particular subjective tests that are used to assess anxiety, depression, etc. So if you want to know about an individual test, it's in the book. So yeah, using those tests, definitely Reiki has shown to improve that condition.
Yes. We are 2 minutes to the hour, and we have a number of questions and also comments in the chat. So let's take a brief break from your answering the questions to show the slide on how people can order your book, and then we'll come back to the questions. So yes, Hillary, that's the slide. So Anne Baldwin's book, Reiki in Clinical Practice, a Science-Based Guide, is available for 25% off with free shipping in the US and the UK. Here's your code that you can screenshot in order to get this book. And here are Anne Baldwin's contact details. So screenshot those as well. The website for her business, Mind Body Science, and the website that was noted earlier in the chat, the Center for Reiki Research.org, and an email where you can get in touch with Anne. Anne, do you have additional comments or summary comments regarding contact information, contact details?
Yeah, email is really good. Or you can go to my website and contact me through the website too. But yeah, I respond to emails very quickly.
Yes. And we'll just note that our next event of Move to Learn will be Wednesday, September 2nd, with David Lazandeck, the much beloved author of the groundbreaking book, Fascia, What It Is and Why It Matters. So David is a very engaging speaker, very, very knowledgeable, and we'll look forward to joining with him on Wednesday, September 2nd. Now, and back to the questions that have been accumulating. From Rachel comes the question, do you feel that to give animal Reiki, such as to a horse, you should do a specific animal Reiki course? Or does do the other Reiki educations cover animals also?
That is an extremely good question because I do animal Reiki and human Reiki. And I think that it would be really good if some animal Reiki courses could be put together. You can do Reiki on animals with the normal Reiki attunements, going through the normal Reiki training. You can do Reiki on animals, sure, but I think a specific course would be extremely useful. And you could gear it towards particular animals as well. One interesting thing with horses is that they help you because, well, animals in general, it's great to do. I like giving Reiki to animals because they don't come with any preconceived notions. They're not out to please you. They're not out to make you look stupid, and they're not skeptical. And they don't have expectations. They're just there. And I think that really helps with the integrity of the giving and receiving of the Reiki. The other thing is that horses in particular, they will tell you when it's done. So when it's done, they'll just go away. Because one of the rules of Reiki, as many of you know, is that you should not give Reiki unless the person asks for it. And animals can't ask for it. So what do? Well, what I do is say, I ask for the Reiki to go to the highest good of the animal if they need it or if they require it. And if not, for the Reiki to do good elsewhere. But the horse will tell you, because if they don't need it, they will just walk away. And when they're finished, they will just walk away. So it's very, very clear. And of course, that's what you don't get from humans necessarily. Maybe some, but not always. Whereas they think, with humans, okay, I've paid for my hour of Reiki and I'm going to stay here for an hour. Whereas with horses, okay, I'm done now. So yeah, I think giving a course on Reiki for particular animals would be really good. And also where to give the Reiki, what signs to look for if the animal is accepting it or not interested, or if the animal is relaxing. Different animals have different ways of showing how relaxed they are. So I think reading the animal as well, that would be an important part of the course. So I really, really like that question. And that's got me thinking about maybe setting up a Reiki course for animals.
The next question is from Eve Sedano. Have there been any Reiki studies on pregnancy outcomes and antenatal or prenatal care?
No, there have not been, and there should be. So that's a quick answer to that one. I'm talking about in peer-reviewed published papers, scientific. So obviously, I'm sure there have been lots of other studies, maybe not written in scientific journals, but in scientific journals, the answer is no.
Yes. Now, in the chat, there have been some comments from people who are trained Reiki practitioners. And this one from Wendy Gordon. Hello, my name is Wendy Gordon. I am a Reiki practitioner and teacher based in Nottingham in England. I have interest and experience with chronic long-term pain, distant healing, anxiety and depression, animals, workplace stress, and pregnant women, babies, children. I used to be a midwife too, and am wanting to become accredited too, so I can practice everywhere. So, and perhaps you and Wendy Gordon can have an exchange on email in order to develop this interest and these studies in the prenatal care area.
Totally, that would be very good, yes.
Yes. Here's a question from Tatia Churchill. Good afternoon. My question relates to Reiki distant attunements. Not all agree on their efficacy. However, I carried out my first Reiki level 1 attunement from the UK to Canada last week, and from the FaceTime call immediately after and the description of the experience given by my student, I am in no doubt that it was a successful attunement. If anything, a stronger energy link was achieved. I would be really interested to hear from you, your view on this, please, as I am keen to learn and carry out my Reiki teaching in integrity.
Yeah, as I said earlier, I have not personally given a virtual Reiki attunement, but I know people who have, and I see no reason why it should not be valid, because Reiki works through a distance, and it makes sense that if you can give Reiki, you can send Reiki through a distance, then you should be able to do the attunements through a distance as well. And the more information that we get from people like you who have done it and have got feedback from your recipient, from your student, the more information we can get like that, then I think that would be really useful to put that together. Then people become more confident in doing these virtual Reiki attunements, which at this point, with the circumstances as they are more and more necessary.
Yes. And given that you so gracefully bridge the gap, go easily from being a master Reiki practitioner to designing very credible studies in physiology, do you have some guidance on how people who are interested in becoming involved in research, how they can do that with integrity and credibility?
That is just a totally amazing question, because only yesterday I was having a discussion with 3 other members of the Center for Reiki Research on that absolute topic, on that particular topic. And we are we're revamping our website. And that is one thing that we are stressing, that we will be available to advise people on how to set up valid research studies on Reiki. So look out for that website, and we should be having the revamp done pretty soon.
Good news. Here's a question. Do you use Reiki to cleanse houses of bad energies or ghosts?
Yes, yeah, you can really use Reiki to clean up the atmosphere. It really does work. And if you can always recognize, well, I can always recognize, I'm sure other Reiki practitioners can too. You can walk in a room and you can feel, okay, I know that lots of Reiki has been done in here. It's just a feeling that you get when you go into the room. And you can walk into another room and it just doesn't feel right. So absolutely, you can change the energy in the room. And there have been several studies by some scientists in Russia, and they have devices that can actually pick up on the energy in a room, and they compare like before and after a big event in the room, and they can see changes in that energy. So I think that it's I really do believe that you can use Reiki definitely to change the energy in a room.
Yes. And we're getting to the end of our 1 hour plus 10 minutes. So I have a special request. Before we start the broadcast, you and Hillary at Handspring and I asked if you would if you would give us some Reiki before the broadcast, which you did. So now I'm wondering if for a closing ritual, closing experience, you would do something similar or something appropriately for the people who are still involved in the broadcast.
Sure, yes. So I will send distant Reiki to all the people who are attending this webinar and who are still on right now. So let's go. Well, thank you very much. I felt very tingly then. I felt all the tingliness of all the people.
Thank you very much, Anne. And now we'll see the slide that shows people how to get your book and how to stay in touch with you.
Thank you so much.